So thank you to our three speakers for this afternoon. Any questions from anyone? Right, we've got one here.
Just a question, probably more to Julie, about looking at the wider picture, not just looking at the inpatient areas, and actually how we go forward and ensure they're part of that establishment review, and whether that is a bi-yearly as well, or whether it's yearly or something different.
I think it's fair to say we're not there yet. I think it will ultimately be biannually. CNSs, we're kind of building using the job plans, and they do an annual report at the moment. So it gives us an opportunity to look at that. I think for us, probably the most challenging group to do it biannually would be our CNSs. I think the departments are much more straightforward, the data's more readily available. Our education teams is also tricky as well, so kind of practice development, but I think it's fair to say it should be biannually, because our services are changing all the time, and the patient demands on various national guidance, so it should absolutely be, but we're not there yet.
Anybody else? Any other questions? Yes.
So this might not be a question for the panel, but might be a question in general. And outpatient nursing, and how you're doing all that work in terms of getting benchmarks and looking, at your own staffing levels.
Well, from our perspective, we include outpatient nursing in the establishment review, but it is slightly different for us. We don't include radiographers in it at all at the moment. So, but it would be great to do that. We use award accreditation, which Julie spoke about earlier, to assess our areas, and we're just developing award accreditation for outpatients as well. So that will help us in that, but we don't do radiographers at the moment.
Over here. Just the far table, just the lady with the glasses, I think. You've got a question. Was there a question over here? Yeah, you do.
Hi, I'm Karen Kay, Deputy Director Nursing at Clatterbridge Cancer Centre over on the Wirral near Liverpool. Mine was a little bit of a plea, really. There's been so much good work. It's probably for maybe Julie in particular. There's so much good work around annual reports and monthly reports, and I know all of us are trying to juggle what does good look like and how can I keep this information as succinct as possible but actually make sure I get all the big hitters in. So I was just wondering, very cheekily, are you able to share with us a copy of a monthly report, a copy of an annual report, just so that it gives us a bit of a good steer around actually what does good look like? And everybody's so busy, we've got to start sharing a lot more, and there's no point trying to reinvent the wheel, to use that old adage. But yeah, for me it's just sort of having something tangible to say, oh my God, I know what I'm aiming for now, this looks great, and then you can do your own sort of spin on it, but at least you've got a good starting point.
Yeah, very happy to. I think Anne's got all of ours, but very happy to. So either contact Anne or myself, no problem at all.
Thank you.
So in addition to that, some of you will know that NHS Improvement has started running a CNO safe staffing faculty, and our first group started in February. But we are at the moment in the process of setting up a web page at NHSI, which will be all around safe staffing. So in the future, we're going to have a large number of resources. We're going to put everything in there together, and certainly examples like Julie's will be in there for the future. Any other questions?
One more, sorry. This is more probably an overall question. I know we're doing analysis for ward and areas, but just wondering, we've done the occasional review for nurse specialists and people in those kind of areas who aren't quite AHPs, that kind of sit in departments but aren't. What kind of review basis analysis are you doing in those sections?
I'm sorry, I didn't quite hear your question.
Sorry, it's about nurse specialists and probably, research as well. What kind of analysis are you doing for those kind of areas?
Okay. So it's around clinical nurse specialists, research nurses. How are you looking at the staffing and getting the numbers right and the planning right for those groups?
So all of our, well, I should say probably about 90% of our CNSs are job planned now. So we do report into our nursing and midwifery board quarterly on CNSs. So we have the job planning element. Then we look at vacancies in that group, because some of those posts are really hard to recruit to. Then actually it can be lost in terms of what the issue is with CNS staffing. So we are looking to include that in that report going forward, and maybe some measure of the care that's left undone, whether it's outpatient clinics that aren't being run, or services that are provided to inpatients, to kind of try and quantify the impact for that group. But I think it's fair to say we are in the early stages. So we've had a job planning policy for a long time. We've got the job plans in an Excel spreadsheet. We're moving on to an electronic system which will help us much more. We've moved away from the medical model of job planning, so it is nurse focused. Our AHPs are doing the same. But I don't think we're much further ahead than anybody else on this, but there would be a few of the things that we're planning to do.
Michelle, did you want to add anything?
No, I mean, the only thing that I would add is that we're not as good as that. So we're not quite at that stage. We have done a big piece of work with working with NHSI to look at what our CNSs do, to look at clinical time and non-clinical time, and the evidence base around that. So we are at the moment job planning all our CNSs, not only because it's the right thing to do for them and for patients, but actually what we found as part of our review is that there was a huge amount of income that we weren't collecting that CNSs do. So they do a fantastic job, and we don't pick all of it up. So we are at a sort of an earlier stage than Julie's just described. And with ACPs, we do have a lot of ACPs in our organisation, and we have gone through the thing with them. They are all job planned. They all are on a master's or have a master's, or so we have an ACP strategy in CNSs we're just working through now. But I love the idea of reporting that quarterly to Trust Board. I think that's really good practice. I'm going to steal it.
Sorry, mine was just a comment, and I was going to say more or less what Michelle's just said. We've just completed a trust-wide non-ward-based review, and I just want to share, I think it's one of the tricks that we often miss. So we've tried to capture in that both some of the quality aspects of non-ward-based nurses, but also the financial aspects. So not all non-ward-based nurses will bring in money, but many of them do, and many of them bring in considerable amounts. And actually, in the majority of our divisions, what we've been able to prove is that the non-ward-based nurses are earning far more income for the trust than they cost. And it's just a really useful trick to be able to use, because when organisations are under financial pressure, one of the first places that finance directors will look is, what are these 500 or whatever non-ward-based nurses doing? And so I just wanted to share that as something we're not perfect. It's like pulling teeth, getting the information. But I think it's a trick in nursing we've often missed. The only advice I would give is you need at least 6 months to do it, because when you start getting divisions, if you're a reasonably big organisation, to start that piece of work, they discover all sorts of things like nurse-led clinics that haven't been coded, all sorts of things. So I would say it's a piece of work really, really worth doing, because also often can be used as a tool to recognise the work of non-ward-based nurses in their broadest sense.
Anybody else?
Is that it? Okay. So I will close there. It's been a fantastic day, and thank you very much for contributing and for sharing your experiences with us. I think Michelle's final slide is a really excellent one to end on. Remember that bringing you all together here is giving you networks, so get support and help from your colleagues. You've got to know some people today. You've got all our email addresses. We can reconnect you if you want. Keep true to your values and be proud of the jobs you do in the NHS. Thank you very much.